Thank you very much. Thank you for those kind words, Mark Wayne. Thank you to Jim O'Neill, to Tom Jodesnek, to Marty McCary, and to Wendy as well. Thank you for that, for sharing your story. It's with a heavy heart that I'm announcing that the conspiracy theorists were right again. COVID mRNA vaccines caused a litany of injuries, including but not limited to turbo cancer, heart failure, extreme blood clotting, and perhaps gayness. That's a chicken and egg problem that we're still investigating. The implications are substantial, and there's no easy way to say this. Anthony Fauci is a goblin. And if you weren't gay prior to taking the vaccine, there's a massive chance that your sudden desire to binge the Bravo channel and watch Tim Walz rallies isn't an accident.
Hi, I'm Robert F. Kennedy Jr., your HHS secretary. Let me ask you something. Should doctors make decisions based upon what's best for their patients or based upon what makes them the most money? It's not a tough question, but we've inherited a healthcare system that constantly pushes doctors toward the latter. It rewards certain treatments not because they're better for the patient, but because someone profits. Take what happened during COVID. Hospitals were paid to report staff vaccination rates. Those numbers were fed into the National Healthcare Safety Network, then published on the CDC website to shame any hospital that refused to become an enforcer of federal vaccine mandates. Today, I'm proud to announce we've eliminated that policy by repealing a dangerous Biden-era provision in the CMS inpatient payment rule. And we're not stopping there. We're scanning every corner of the healthcare system for hidden incentives that corrupt medical judgment. What we're finding is alarming. Doctors are being paid to vaccinate, not to evaluate. They're pressured to follow the money, not the science. We've recently uncovered that more than 36,000 doctors had their Medicare reimbursements altered based upon childhood vaccination rates. That's not medicine. That's coercion. It's immoral. It has no place in a constitutional democracy or in a system that claims to protect children. Medical decisions should be made based upon one thing and one thing only: the well-being of the patient, never on a financial bonus or a government mandate. Patients deserve honest, uncorrupted advice from their doctors. Doctors deserve the freedom to use their training and to follow the science and speak the truth without fear of punishment. Doctors should be guided by medical judgment and their Hippocratic oath, not by financial incentives or government mandates. That's what this policy change is about, and it's just the beginning. Thank you very much.
Produced by the U.S. Department of Health and Human Services.